Good morning, welcome to Happy Toe Tuesdays. Today I'm talking about bacterial infections of the skin. Now this is very challenging condition because it happens quickly, it happens fast, and it has to be managed very fast. So what happens is your skin becomes broken, and the bacteria gets in, and then it's an infection, and it leads to cellulitis. Now this can happen for different reasons. Maybe, I'm not saying it's everybody, but sometimes poor hygiene, especially with men being between the toes. They don't dry properly, and then the skin gets broken, and that's where the germs get in, and then it creates a big problem. And it leads to cellulitis, especially overweight people as well. They get cellulitis easily, and it's basically soap and water will clean and fix a lot of stuff, but if it's not caught in time, it can lead to different things, and especially for diabetic patients, it's a challenge because you have to manage it fast, otherwise they could lose a limb. Now, how do you know it's cellulitis? Is the skin is not smooth and healthy and hydrated. It's very swollen, especially the lower extremities are very swollen, and the skin is thin because it's stretched so much, and it can lead to blistering, which makes it very prone to more breakdown and even exudate that comes out, and the blisters can break. So what you need to do if you have cellulitis, it happens fast, is to get to the doctor so that you can get intravenous antibiotics, because this is the best, fastest way to treat it, and that you can make sure that you improve your circulation. That they will tell you to put on stockings to improve the circulation. Now, it sounds awful to put on stockings on a limb that's already swollen, but what it does, it just puts it in a structure where it prevents it from swelling so much, so that you can just get to a normal anatomical size. So, and sometimes when it's broken skin, you can use special bandages that improve your structure of your leg. So yes, the most important thing is to see your physician. Don't play around with it, because it is bad news. It can spread fast, and then it's a big crisis. So they will hospitalize you with intravenous antibiotics, and hopefully it will be just a day thing, or if it's longer, it'll take longer, but that's just God giving you the day off. So just see it that way, and then pay special attention to have all your skin be intact again afterwards. So make sure that everything heals, and that you keep an eye on it, especially if you're a diabetic, to make sure that it's not going to be a problem for you, because one wound can easily become a 2-year wound dressing changes every week, and it's very expensive. So the best thing is just to make sure that you treat it immediately and take it very seriously before you just move on. So the best thing I would say to prevent it is to make sure, if you have fungal infections, if you have bacterial infections on your feet, to manage it faster now, so that it doesn't escalate and become a bigger systemic problem. So here you go, cellulitis. Enjoy the rest of your day. This is Happy Toe Tuesdays. My name is Martie. Hopefully I specialize on foot care, and you can follow me and subscribe to my channel, and if you have any questions, you can leave it to me, and I'll see if I can do a video on that.